Hello everyone, Professor Vague here. This is your lecture on acid-base imbalances. Please complete your assigned readings and review your key points in the module. So let's get started. These are the learning objectives that we will be covering in this lecture. The body maintains a very narrow arterial blood pH and that lies between 7.35 and 7.45, with 7.4 being approximately the normal, right? And this is extremely important to maintain homeostasis in the body. So carbon dioxide is the primary acid source in the body. A lot of health problems such as diabetes, COPD, kidney disease, all of these can lead to acid-base imbalances. So it's extremely important to remember that acid-base imbalance is not a disease in itself, but it's actually a sign of an underlying problem. So anytime you have a patient with a serious illness, you should always consider the possibility of an acid-base imbalance because it could point towards a disease, an underlying condition the patient has. So let's look at the pH range. So the pH reflects the concentration of hydrogen ions in the blood. So when hydrogen ion levels increase, the pH decreases, which means it becomes more acidic. When hydrogen ions decrease, the pH increases, meaning it becomes more alkaline. So the pH scale ranges from 1 to 14, where 7 is neutral. So values before 7 are acidic and values above 7 are alkaline. Normal blood pH is slightly alkaline, right? It's between 7.35 and 7.45. So if the pH drops below 7.35, we have acidosis. If it rises above 7.45, then it's considered alkalosis. As you can see here, this over here is the normal pH that's maintained by the body. Anything below the 7.35 mark is acidosis. Anything above the 7.45 mark is alkalosis. And either direction, extreme imbalances can lead to death. Clinically, we monitor this balance using ABGs, arterial blood gases. That's basically measuring the gases inside the arterial blood. For diagnostic purposes, we look for a normal partial pressure of oxygen, which is the PaO2, of approximately 100 millimeters per mercury, and a normal partial pressure of carbon dioxide, the PaCO2, of 40 millimeters per mercury. These values serve as our primary benchmarks for identifying when a patient is drifting into a state of acidosis or alkalosis. So ABGs give us objective information about a patient's oxygenation and acid-base status. We look at oxygen levels, carbon dioxide levels, and bicarb. Carbon dioxide reflects the respiratory component, and bicarb reflects the metabolic component, which is regulated by the kidneys. And knowing the normal values helps us quickly to identify the imbalance, especially to know if, is it respiratory acidosis, alkalosis, metabolic acidosis, or alkalosis. So these are the measures that we use: carbon dioxide for respiratory and bicarb for metabolic. So the body has a buffer system, basically. Buffering is the primary regulator of acid-base balances, because remember, there's a very narrow window, right? The 7.35 to 7.45. And in order to keep that pH right there, the body has to have buffer systems to prevent any extremes from happening. So this is basically the body's first line of defense in maintaining that balance. They work by converting strong acids into weaker ones and binding excess hydrogen ions to minimize changes in pH. So, however, the buffers can only do so much. They rely on the lungs and the kidneys to fully regulate and restore balance. Your lungs have to be functioning properly and breathing in enough oxygen or exhaling enough carbon dioxide, and your kidneys have to be strong enough to regulate these things. So these are your three defenders of pH. Your chemical buffers, which is the first defense, your second defense, the respiratory system, and then defender 3 is the renal system. So if you notice over here where it mentions the time that it takes, so your chemical buffers are the first one because it takes seconds to kick in. The second one, the respiratory system, takes minutes to kick in, and it can be, almost, like maybe almost a few hours. The renal system can take hours and days, at least 24 hours to kick in. So the body basically uses the opposite system to attempt to normalize the pH. So when an imbalance occurs, for example, if it uses 3 of these mechanisms, right, to regulate the balance. So chemical buffers, the fastest one responds immediately. Second one is the respiratory buffer system. It responds in minutes and reaches a maximum effectiveness in hours. Respiratory compensation for metabolic acidosis. For example, if somebody has metabolic acidosis, so respiratory compensation can take up hours, right? So when metabolic acids like keto acids accumulate, they stimulate the respiratory reflex center in the brain. The triggers increased frequency and depth of breathing. Why is that? Because we're trying to hyperventilate. The body wants to hyperventilate, such as Kussmaul breathing, right? To blow off the CO2. There's too much CO2, we need to blow it off and reduce the total acid load in the body. So the respiratory compensation for metabolic acidosis is that it, in states of alkalosis, metabolic alkalosis, for example, when a patient is vomiting a lot, right, the respiratory center will slow down. It will cause hypoventilation because now you have too much alkalosis in the body, right? And so when you're hypoventilating, you're causing CO2 to stay inside the body, to retain and accumulate, to help lower the pH, to make it a little bit more acidotic. And so if there's too much acidosis, then you're going to hyperventilate. If there's too much alkalosis, then you're going to hypoventilate. So that's how the respiratory system helps. Now let's talk about the renal system. How does the renal system help with this? The kidneys eliminate hydrogen ions, but this process is super slow. Okay, it can take hours to days to compensate for respiratory issues. So, and it responds in hours to days after a change in pH. It can maintain balance indefinitely in patients with chronic imbalances. It's the best buffer system, the most strongest one, the most effective one, but it's slow. It takes time. However, with people who have impaired kidney function, it's not going to work as effectively. So these are all our compensatory mechanisms. Sorry, I cannot pronounce that word today. Okay. So now this is a cheat sheet that I created for the buffer systems and how they work. Basically, there are 3 systems, mechanisms, buffer systems, or compensatory mechanisms. The body has to maintain the pH between 7.35 to 7.45. Chemical buffers, the fastest one. Respiratory system responds in minutes and reaches maximum effectiveness in hours, because obviously you're not going to hypoventilate for 3 days, right? I mean, at least you shouldn't, right? And so it takes its maximum effectiveness in a few hours. Renal system responds in hours to days after the change in the pH, but it maintains the balance indefinitely, especially patients with chronic imbalances. But if you have an impaired kidney, say you're diabetic and your kidney function isn't the best, then it's going to work even slower or not as effectively. Okay, so let's walk through how the body regulates carbon dioxide and why it's important for acid-base balances. So, at the center of the concept is understanding that the lungs play a major role in regulating the pH. How does it do it? It does this by controlling how much CO2 is exhaled. Carbon dioxide is a byproduct of metabolism. So when it accumulates, it can affect the acidity of the blood. It increases the acidity. If you have too much carbon dioxide, it's going to increase the acidity. So now when CO2 enters the bloodstream, it moves into the red blood cells and combines with water to form carbonic acid. This carbonic acid then quickly breaks down into hydrogen ions and bicarb. The hydrogen ions contribute to acidity, basically while bicarbonate, acts as a buffer against this acidity. Hemoglobin helps by binding to the free hydrogen ions, because remember, where's all this gas exchange happening? A lot of the gas exchange is happening in your lungs, right? And so now remember, the oxygen, when you breathe in, you breathe out the carbon dioxide. Gas exchange happens at the alveolar level in your hemoglobin, which then gets sent to the heart, and then the heart circulates oxygenated blood throughout your body, right? So remember, this is like all of these body systems are very closely connected. So how does the hemoglobin help in this? It helps by binding to the free hydrogen ions and preventing large changes in pH, while bicarb moves into the plasma. So this leads us to the key point. Carbon dioxide levels directly influence hydrogen ion concentration and therefore the pH. So when CO2 increases, acidity increases. When CO2 decreases, acidity decreases. So the pH is very closely, related to the carbon dioxide. Now let's look at how breathing affects this process. So with increased respirations, which is called hyperventilation, you're breathing in fast, but you're not breathing in deep enough, then what happens? You have more carbon dioxide is exhaled. Okay, you're blowing off carbon dioxide. Okay, and you're taking in oxygen really fast. So this reduces carbonic acid and hydrogen ions, because remember, carbon dioxide is what's helping create carbonic acid, right? So this causes the pH to rise, leading to alkalosis, right? When the pH is high, you have alkalosis. pH is low, you have acidosis. Now, on the other hand, with decreased respiration, for example, hypoventilation, carbon dioxide is retained in the body. So you're not breathing fast enough to blow off the CO2. So this increases carbonic acid. More carbon dioxide, more carbonic acid, and hydrogen ions. This lowers the pH, which causes acidosis. So the rate and the depth of the breathing are controlled by the respiratory center in the medulla. This center constantly monitors the CO2 and hydrogen ion levels. So when levels are high, it stimulates faster and deeper breathing to remove the CO2. When levels are low, it slows the breathing to retain the CO2. It senses this in your medulla. Finally, it's important to consider the clinical implications of this, right? For example, older adults have a reduced ability to compensate. And why is that? Because they have decreased respiratory function, which makes them more vulnerable to acid-base imbalances. So the big takeaway here basically is that the lungs regulate acid-base balance by controlling CO2 levels, which directly affects hydrogen ion concentration and eventually the pH of the blood. So this is the role your lungs play in maintaining the pH. So now let's focus on how the kidneys regulate acid-base balance, because remember we said there are three buffer systems, right? You have your chemical buffers, respiratory, and then renal, kidney. So now let's look at the kidney. The primary role of the kidney is to maintain pH by absorbing and conserving bicarb, which acts as a base, and by excreting acids that are produced during normal cellular metabolism. So when metabolism happens in cells, acid is formed, and so the kidneys excrete that. This makes the kidneys a key player in the long-term acid-base regulation. So there are several mechanisms in the kidneys used to excrete acid. First, they secrete the free hydrogen ions into the renal tubules, which helps remove excess acid from the body, right? Because where is the acid going that's in the renal tubules? You are going to urinate it, and so it's excreting it. Second, the hydrogen ions can bind with ammonia to form ammonium, which is then excreted in the urine. Third, the kidney also eliminates weak acids, further helping to regulate the pH. The kidney can also adjust the pH of the urine as a compensatory mechanism. Normally, urine is slightly acidic. The average pH of the urine is about 6. However, depending on the body's needs, the kidneys can make urine more acidic. lowering the pH to around 4 by excreting out the acid, or more alkaline by retaining the acidity and increasing it to about 8. So it's important to note the key clinical consideration. Older adults often have reduced ability to compensate for acid-base imbalances because their kidney function isn't the best. So it's important to really remember how, that as we age, these, the function of our lungs and kidneys decreases. So the main point here is that the kidneys help maintain acid-base balance by retaining bicarb and excreting hydrogen ions, working to keep the body's pH within a normal range. So now, how do we classify the alteration, right? I mean, we talked about, okay, low pH is acidosis, high pH is alkalosis, but how do we classify this? Acid-base balance depends on a 20-to-1 ratio of bicarb to carbonic acid. So 20 of bicarb, 1 of carbonic acid, right? Imbalances occur when one side of that ratio, the 1 to 20, changes and the other systems cannot adequately compensate. So we classify the imbalances as either respiratory, which involves CO2, or metabolic, which involves bicarb. A simple way to remember this is respiratory is a CO2 problem, metabolic is a bicarb problem. That's the main key takeaway for you. So this is a cheat sheet. Again, if you can print it out, download it, however, and review this. It's really important. So let's look at respiratory acidosis versus alkalosis. Let's break this down. The two main respiratory acid-base balances are respiratory acidosis and respiratory alkalosis. And let's look at how they also affect the body. Let's start with respiratory acidosis. This condition occurs when a patient is hypoventilating, meaning they're not breathing effectively enough to remove CO2. As a result, CO2 builds up in the blood, right? So this excess CO2 combines with water to form carbonic acid, which then dissociates into hydrogen ions and bicarb. The increase in hydrogen ion causes the pH to drop. And what will this lead to? Acidosis. So if this condition persists, the body begins to compensate, because remember, your body is always going to compensate. It has a lot of compensatory mechanisms, right? So it's always going to try to protect you and protect the brain, because the pH is extremely important for the survival of the brain. It has to be between that 7.35, 7.45. That's how your brain likes it. And that's what the body is going to try to do, is keep it in that window. So if this condition persists, then the body begins to compensate. What happens? Now, if you have high CO2, you're hypoventilating, you're retaining carbon dioxide, the other system, which is your kidney, your renal system, is going to respond within about 24 hours. How is it going to respond? It's going to respond by conserving bicarb, because that acts as a base, right? And it excretes more hydrogen ions into the urine. See, and so now it's going to excrete that acid in the urine, and this helps to buffer the excess acid and gradually bring the pH closer to normal. So that's how, respiratory acidosis is dealt with in the body. Now let's look at respiratory alkalosis, which is essentially the opposite problem. This is going to happen when people hyperventilate, where, for example, you're breathing too rapidly or too deeply. So what's going to happen? This causes excessive loss of CO2. Now you're losing a lot of CO2. So what's going to happen? It's going to increase your pH. It's going to become alkalosis. With less CO2 available, there is less carbonic acid formed, which leads to a decrease in hydrogen ions and an increase in pH, right? Resulting in alkalosis. So you're not going to have enough carbonic acid anymore, and so it's going to cause alkalosis. So then what's going to happen? There are several causes. First of all, let's look at why people hyperventilate, right? There are several reasons, including hypoxemia from pulmonary conditions like pneumonia, or pulmonary embolism if there's a blood clot, or if there's pneumonia, or, fever, anxiety. People hyperventilate when they're anxious, or even central nervous system disorders can cause this, right? So In some cases, hyperventilation is a compensatory response, such as in metabolic acidosis, where the body is trying to blow off the CO2, right? So, compensation for respiratory alkalosis. Now, when you are retaining the CO2, you're hyperventilating, you're blowing off the CO2, sorry, and you're blowing off too much CO2, then how does the body compensate for that? The priority is usually to treat the underlying cause. First, correct the hypoxemia. In cases of anxiety or panic, relax, right? We help the patient relax, calm down, right? So they can help rebreathe the CO2 in. So that's the first thing. Over time, the kidneys will also help by excreting the bicarb, especially in chronic conditions. So the kidneys help by basically excreting the bicarb. So basically, just to sum it up, respiratory imbalances are driven by changes in CO2. Too much CO2 is acidosis, too little CO2 is alkalosis. And the opposite system, which is the renal system, if there's too much CO2 and there's acidosis, is going to respond by, increasing the bicarb and excreting the acid. Too little CO2 when you're hyperventilating, taking in too much oxygen, not blowing off enough CO2, it's going to lead to alkalosis, less carbonic acid, and so the kidney is going to respond by lowering the bicarb and increasing the acid. So this really, help. It's important for you to understand. So please print this out and review this. Now let's talk about metabolic acidosis and metabolic alkalosis. Metabolic acid, let's walk through the two major imbalances, right? So metabolic acidosis and alkalosis. And we're going to talk about how the body responds to each of these. Let's start with acidosis. This occurs when there is a deficit of bicarb. Because remember, we're talking about your metabolic part now. You're, controlled by the renal system, right? So what happens here? So when there's metabolic acidosis is when there is a deficit of bicarb, too little bicarb, or when acids other than carbonic acids accumulate in the body. In simple terms, there is either too much acid or not enough base. So what causes this? DKA, diabetic ketoacidosis, can cause this, where ketones build up in the blood. Lactic acid accumulation during shock. When they have sepsis or something, their lactic acid increases. Accumulation of the lactic acid. And severe diarrhea can also cause metabolic acidosis because it results in the loss of bicarb. Now, to compensate, the body activates both the kidneys and the lungs. So how does it do it? The kidneys attempt to excrete the excess hydrogen ions and conserve bicarb, while the lungs increase the rate and depth of breathing to blow off the carbon dioxide. So this results in a characteristic breathing pattern called Kussmaul respirations, which are deep and rapid breaths aimed at reducing acidity. Because remember, too much acid, the body's trying to, get rid of the acid, right? And so your lungs are going to help to do that through Kussmaul respirations, which are deep and rapid breaths. So you're increasing the O2 and getting rid of the CO2. Another important concept in metabolic acidosis is the anion gap. This, which helps us determine the underlying cause. The anion gap is calculated using sodium, bicarb, and chloride levels. A high anion gap suggests acid accumulation, such as in DKA. So when a patient comes to the ER with DKA, their anion gap is checked to confirm the DKA diagnosis, while a normal anion gap typically indicates bicarb loss, such as with diarrhea. So this is basically metabolic acidosis. Now let's move to metabolic alkalosis, which is essentially the opposite problem. This happens when there is excess bicarb or a loss of acid. So if there's a loss of acid, then what's going to happen in your body? Right? Common causes could be prolonged vomiting. You're vomiting, vomiting a lot. It leads to loss of stomach acid when you're vomiting. Ingestion of substances like baking soda, which also increases bicarb levels. And so if it increases bicarb levels, then your acid levels are going to decrease. Now, in terms of compensation, the kidneys respond by excreting excess bicarb And what do you think the lungs are going to do if there's too little acid? So while the lungs attempt to retain the carbon dioxide, why are they retaining the carbon dioxide? Because they want to increase acidity and carbonic acid. There's too much bicarb in the body. That's alkalosis. And so now we're going to hold that carbon dioxide in to make more carbonic acid to increase the acidity in the body. So, however, respiratory compensation is limited because the body still needs to maintain adequate oxygen, right? We can't just keep holding in that CO2, right? Because your body still needs to oxygenate. And so it's very limited at what the lungs are very limited at what they can do and how long they can do it. So the key takeaway here is basically that metabolic imbalances are driven by changes in bicarb, just like we talked about respiratory, right? We said respiratory imbalances are driven by CO2. Metabolic imbalances are driven by bicarb. And the body compensates by using both respiratory and renal mechanisms to restore the normal pH. Okay. These are the clinical manifestations of alkalosis, respiratory alkalosis, and metabolic alkalosis. As you can see, they affect every system of the body. Besides knowing what we would expect to see, it's important for us to understand why these symptoms happen. It's, some people can easily memorize these and regurgitate them, but it's really important for us to understand why each of these symptoms happen. So on this cheat sheet over here, I kind of created, the possible causes so you can understand why these symptoms are happening and not just memorize them, right? Because if you can understand why they're happening when you see them, you can it'll help you to understand what the underlying condition might be, and this way you can help your patient better, right? And so, for example, let's just cover like blood pressure, hypotension, decreased blood pressure, right? What could possibly cause it, right? Fluid volume deficit, low calcium, high magnesium, right? Hypertension. What could be the problem for fluid volume excess? High calcium, low magnesium. So there's so many different, reasons behind each of these symptoms that we see. So please review this so you can, and try to take a few minutes to try to understand what's going on behind each of these symptoms. Okay, understanding ABGs. Most people have a very difficult time understanding ABGs and interpreting them. It is a huge complaint I hear in nursing school from students in Block 2 when they're covering med-surg and the respiratory system. They find it very difficult to understand how to interpret ABGs and how to label them as acidosis or alkalosis. Is it respiratory or metabolic? Is it compensated? Is it not compensated? And so I want to take a few minutes and kind of go over that. And then we're going to end with a case study to kind of wrap it up. And there's also a Nearpod that I've posted the code for in the module. Please practice that. It will give you a lot of practice on interpreting ABGs and help you to kind of apply the knowledge you're getting here. Okay, so ABGs help us determine 3 key things. Your arterial blood gases, right? The patient's acid-base status, the underlying cause, and whether the body is compensating. These are the 3 things that you understand from ABGs. They also provide information about oxygenation, which is critical, right, in patient care. We want to know, is our patient oxygenated? Okay, so this is a picture of the acid-base diagnostic matrix, right? So the clinical diagnostic logic. Let's look at it. To identify the type of imbalance, clinicians compare pH and CO2 levels. Okay, for example, respiratory acidosis. pH is low. It's under 7.35, under 7.4, which is the approximate normal. And CO2 is high, right? That means it's greater than 40. So now, respiratory acidosis, low pH, high CO2. We know it's a respiratory problem because how do you know it's a respiratory problem if the CO2 is imbalanced? Okay, metabolic acidosis. It's acidosis, so the pH is going to be low, right? Anytime there's acidosis, the pH is lower than the 7.35 or the normal middle range of 7.4. That means it's acidosis. Now, what kind of acidosis? We know if the CO2 is high, it's respiratory. If CO2 is normal or low, it could be because of compensation. So, and we're going to talk more about that. So, respiratory alkalosis, pH is high, okay? So we know it's alkalosis and CO2 is low. So then we know, okay, it's respiratory alkalosis because pH is high and CO2 is low. Metabolic alkalosis, pH is high and CO2 is normal because your body is trying to compensate. Okay, let's talk more about this. So how do we interpret ABGs? There is a mnemonic called the Rome mnemonic, right? And we're going to kind of go over this mnemonic over here. Respiratory opposite, metabolic is the same direction, equal. Respiratory opposite, metabolic equal. So let's look at it. There are 5 steps for interpreting ABGs. You look at the values, look at the pH first. Now use Rome to determine respiratory or metabolic. Is it respiratory or is it metabolic? See if the patient is compensating. Assess the PaO2 and O2 saturation. These are your 5 steps. I have them right here. Look at each of the values, look at the pH first, use Rome, which is here, and once metabolic or respiratory origin is determined, look at the remaining value, either the CO2 or bicarb, to figure the level of compensation, right? And you want to know, okay, is the body compensating and how much is it compensating? Is it full compensation or is it partial compensation or no compensation? And then you want to assess their PaO2 and oxygen saturation, because if it's abnormal, then that means there's hypoxemia present. Okay, so that is your Rome mnemonic. So the Rome method is a great mnemonic to help you interpret ABGs. And we're going to practice this a little bit. So let's look at the case study, all right? In this case study, Jenna is a 22-year-old female whose friends bring her to the emergency department after being unable to awaken. They state that they have been partying the past 3 days while on spring break. So on assessment, she noticed shallow respirations, right? She's not taking deep respirations, shallow respirations with a rate of 8 per minute. What is the normal amount of respirations? Normal amount is 12 to 20. She has diminished breath sounds and she has a decreased level of consciousness. Okay, so what are our concerns here for Jenna? She's unable to awaken, right? She's been partying the past 3 days, okay? Shallow respirations with a rate of 8, diminished breath sounds, and decreased level of consciousness. So why is this happening with Jenna, right? What does this tell us, right? The shallow respirations and decreased level of consciousness, right? What does it suggest? It suggests hypoventilation, right? She's not breathing enough. So she's hypoventilating. Think about what happens when the patient is not breathing effectively. They're hypoventilating. They're not taking in enough oxygen or not blowing out enough carbon dioxide. What do you think is going to build up in the body? Carbon dioxide, right? And this can lead to acidosis, respiratory acidosis. So, what type of acid-base imbalance would you expect Jenna to have? We mentioned that earlier, respiratory acidosis. What is causing it? Hypoventilation. Because she ingested alcohol, she's way too relaxed, more than she should be, right? And so now she's hypoventilating. What type of compensation would you expect? Now that we know she has respiratory acidosis, we know that it's caused by her hypoventilation, she's not blowing off enough, CO2, then how is the body going to compensate for it? So the compensation will be noted if respiratory depression has been present for 24 hours or more, because remember we said compensation takes time. The bicarb may be elevated as a result of renal compensation, right? If it's past that 24-hour mark, the bicarb may be elevated because how is the kidney going to help? The kidney is going to say, oh my God, there is way too much acidosis in the body. I need to get rid of some of this. It's going to pee out some of that acid and increase the bicarb. So if a respiratory depression has lasted less than 24 hours, you will not really see any renal compensation. It's only going to happen, remember, it kicks in slowly, but it does a really good job at it. So what would Jenna's ABGs look like? So if she has respiratory acidosis, is the pH going to be low or high? Low, right? It's acidosis, right? The bicarb might be normal, okay? Because the kidneys, if the kidneys haven't started compensating yet, the bicarb might still be normal, okay? If it's past the 24-hour mark, it's been a while, then the kidneys are going to kick in and they're going to start compensating, and the bicarb may be elevated because the kidney's trying to bring in more bicarb. Okay, so the PO2 may be less than 80 because of respiratory depression leading to hypoxemia. Because why? She's breathing shallow and she's not breathing enough, so she's not breathing enough oxygen, so her PaO2 is going to be less. What is the treatment? First, we need to determine the cause of the respiratory depression. If it's induced, for example, by opioids or medications or alcohol or whatever it is, then we need, if it's induced by alcohol or other CNS depressants, we need to stimulate her breathing. We need her to breathe so she can breathe in the oxygen and get rid of the carbon dioxide, right? So mechanical ventilation might be necessary if she cannot breathe, do it on her own to increase that respiratory breadth and depth. Increasing the oxygenation and promoting excretion of carbon dioxide will be the way to go. So let's walk through this ABG step by step. These are Jenna's ABGs. pH is 7.31. Is it low? Yes, it's low. If it's low, then it's acidic. Bicarb is 18. Okay, so it's a little low still. The kidneys have not started compensating yet, right? CO2 is 28. What's the normal CO2? The normal CO2 is 45 to 35, so it is low. Okay, so if the pH is 7.31, which indicates acidosis, bicarb is 18, which is low. It's moving in the same direction as the pH, though they both are low. CO2 is 28, which is low. That means that the lungs are trying to compensate, because what are they trying to do? They're trying to blow out the CO2, right? We need more oxygen. We need to get rid of the acidity. So this represents metabolic acidosis with respiratory compensation. So she is going through metabolic. So this represents basically metabolic acidosis. Bicarb is low, it's acidic. pH is low, it's acidic. And CO2 is low, so those lungs are trying to compensate. They're trying to reduce the acidity. Okay? So now, this is the Rome method. Okay? So let's just quickly, recap the Rome method here. First, we always start with the pH. In this case, it's 7.31, which is below 7.35. This tells us that the patient is in acidosis. Next, we apply the Rome method to determine the cause. Remember, respiratory opposite metabolic equal. So now we look at CO2, which is 28. That is low. Since the pH is also low, both are going in the same direction, not the opposite. So this cell tells us that the respiratory system is not the primary cause, because they both are going in the same direction. So instead, it's likely just trying to compensate. Now when you look at the bicarb, and the bicarb is 18, that is also low. Since the pH and bicarb are both decreased, they're moving in the same direction, which matches metabolic side of Rome. What is the metabolic side of Rome? Equal. Metabolic equal. So if respiratory, for example, if pH was low, okay, and CO2 was high, and they're opposite, then it's respiratory acidosis, because respiratory will go opposite, okay, and metabolic goes equally. So now when you look at the bicarb, it's low, and pH is low, then we know it's a metabolic problem. So at this point, we can identify the primary problem as metabolic. and it's acidosis because the pH is low. So remember, when pH is low and respiratory is low, your CO2 is low, they're going in the same direction, so it's not respiratory. Okay, it's the respiratory has to be opposite. So if pH was low and CO2 was high, that means they're opposite, going in opposite directions, then you know it's a respiratory problem. When pH is low and your bicarb is also low, they're going in the same direction, then we know it's acidosis, and we know it's metabolic because metabolic is always equal. So putting it all together, this patient has metabolic acidosis with respiratory compensation. Basically start with the pH, use the room to find the primary cause, then determine if compensation is occurring. So this structured approach helps you to avoid confusion and stay consistent every time you interpret your ABGs. Okay, and that is it for our lecture on acid-base imbalances.